Welcome to a special interview for The Wire. The subject today is the coronavirus. In part one, how serious could be the threat India faces and how effectively is the government responding? And in part two, a question that perhaps everyone wants the answer to. What can we ordinary people do to protect ourselves? My guest is a man who clearly has the answers. He's the director of the Center for Disease Dynamics in Washington and a lecturer at Princeton University in America, Laxminarayan. Dr. Laxminarayan, let me start with a simple question. As of 12 noon today, the 18th of March, the official website of the Health Ministry says we have 130 active COVID cases, not counting the 14 who they say have been cured and not counting the 3 who've died. And many people look at that figure and say, that must be too small. How can a country of India's size have only 130 active cases? Now, you're an expert. Do you believe that figure, 130, or do you have serious doubts?
So the government's website is giving you the number of confirmed cases, and by that definition, that number is exactly right. Now, if your question is, are there other cases out there in the community that have not been confirmed by testing, I think any infectious disease expert will tell you that's almost certainly the case. So most countries are undercounting cases. The UK, for instance, admitted yesterday that they probably have upwards of 10,000 cases, although they've counted only, probably 1,000 or so. And that's because testing has been really inadequate, and that's globally everywhere, in the US, the UK, and India as well. But India is just not tested enough.
So if you apply the UK example to India, and UK is undercounting by a factor of, say, 12, then India's 130 on that same ratio becomes over 1,500.
I think that is a safe assumption to make based on what our models would predict. And perhaps it's even more than that, because you have to remember that the other way to look at it is that the UK has 10,000 cases for a population of about 60 million people. We are 20 times that population. So we're potentially looking at an even larger number, and we just haven't tested enough people to know that number.
So it's quite possible that we actually may have something like 10 or 15,000 cases without knowing about them.
Possibly. And in a country the size of India, 10,000 cases are not that easy to find.
In that event, let me ask you this. What is your assessment as an expert of the way the Indian government has so far responded to the coronavirus crisis?
So India has done some things well. India was amongst the first countries to shut borders. They did that proactively before anyone else did. India has been, doing the contact tracing of people coming back on planes quite early. What India has not managed to do is test enough people, and it has not leveraged the significant capacity that exists in the private sector as well for testing, or nearly even the government labs. So the only labs that have been allowed to test until as of yesterday, I don't know if it's changed today, are really the ICMR labs. There are many government hospitals that are capable of testing. There's a whole private sector that actually handles much of the testing workload on normal times in India, and we have not deployed that capacity.
Let's explore this issue of testing, because it is one of the most critical key concerns about the way India is handling the coronavirus crisis. Now, the ICMR says that as of 5 p.m. on the 17th of March, they had tested a total of 11,500 people. They also say that they're testing roughly 1,000 people a week. Is that anywhere near sufficient for a population of 1.3 billion?
So let me clarify. The 11,500 is a cumulative test till date. They are actually testing probably at a rate, my guess is about 1,200 to 1,600 people a day.
Well, they say it's roughly 1,000 a week.
So that 1,000 a week is a different number. The 1,000 a week is their surveillance figure, where they're going in and testing asymptomatic people, people without symptoms in the community, because their claim is that they assume that there is no community transmission. Today, to get a coronavirus test, you either have to have traveled abroad to a coronavirus infected country, like a one with a large caseload, or you have to have confirmed contact with a coronavirus case. If you don't have both of those, but you have all the symptoms of coronavirus, you won't get tested.
So let me then ask you this. Is that figure of 11,500 people tested up to 5 p.m. on the 17th of March sufficient for a country of 1.3 billion people?
Not nearly. So that translates into about roughly about 10 per million people tested. Just for comparison, Thailand is at about 140. Even Vietnam is at about 40. So we're testing about a quarter of the rate of Vietnam, a small fraction of the rate of Thailand, and let's forget about countries like France or Italy or South Korea, which has tested literally hundreds of thousands of people, possibly in the millions at this point.
Now, Dr. Tedros, the Director General of the World Health Organization, said 2 days ago on television that his advice to all countries was test, 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 test every suspected case. Yesterday on television, Dr. Bhargav, the head of the ICMR, replied to that, and his words were, "This statement does not apply to India, it applies to Europe, it is inappropriate for India." Who do you agree with?
I don't think it's inappropriate for India at all. I think the way it works is if you have not tested an individual, you cannot try to prevent any secondary infections from that individual. How will you know who to quarantine? If we're depending on social distancing and self-quarantining by everyone in this country to contain the epidemic, that is not going to really work because, to be honest, Karan, social distancing is a luxury for most people. If you have to get up, go to work, be on a bus, and you need to put food on the table at the end of the day, you don't have the option of social distancing. This is what people like you and me can do. For the rest of the population, they need to know if they have coronavirus so that those folks can actually be quarantined.
In other words, therefore, are you also suggesting that Dr. Bhargav's claim that this statement by Dr. Tedros is inappropriate for India reflects a certain amount of, I'm using that word carefully, complacency?
So I think the government, and just keep in mind, these are all colleagues and friends, and I don't doubt their intention or their desire to do whatever is required. They work again under other sorts of constraints, and I'll tell you one constraint that actually exists globally. Globally, countries, including in the US, have not been able to get the test kits that are needed because we never anticipated something of this size. And so the simple tools for RNA extraction don't exist. They're made by just a couple of countries.
I fully understand the constraints under which Dr. Bhargav and his colleagues are working. But the problem is that when he turns around and says to Dr. Tedros that this is an inappropriate statement for India, does that suggest a certain measure of complacency?
I wouldn't call it complacency. I would just say I disagree with it because I see these as scientific statements. It's his scientific judgment. But I think that...
But it's a scientific judgment that's based upon the assumption that somehow the limited 11,500 tests in India is adequate. And it's also ignoring the fact that if UK can admit that they have far more cases by a factor of 12 than they actually know about, then that same number is going to be even greater in India.
Absolutely.
And all of that's ignored by Dr. Bhargav.
Absolutely. And there is also an assumption that by CMR that there is no community transmission. And they've done this based on the fact that they say, I have not found any community transmission and therefore there is no community transmission.
But you haven't really looked for it either.
You haven't really looked for it either. So if, to use an example, if I were to only test people wearing white shirts and I were only to find coronavirus cases in people wearing white shirts, I couldn't then conclude that you had to wear a white shirt to have a coronavirus case.
But this is very interesting. They say they found no evidence of community transmission, but they haven't really looked for it, and therefore you're not going to find what you haven't looked for. So I come back to my question. Is there a hint of complacency behind this attitude? Let's not name Dr. Bhargav, behind the attitude of the authorities as a whole.
See, Karan,
false comfort. Let's not call it complacency. Is this false comfort?
I think they are extremely concerned. So let me place this. These are colleagues and we talk all the time. I don't think they are being complacent. I also don't think that I think they fully know what they're up against right now. We're up against a serious situation.
But then is it just that they're not admitting the problem because they don't want to panic people?
They probably don't want to panic people. And the second thing is, Karan, you've got to remember, if this country is shut down mostly across the country, shops, schools, every public event that they can actually control, if that is happening, you have to remember the country does not do that for 120 cases. The country does it because it's taking it seriously that this is a serious issue. So
in other words, you're saying the actions suggest that the government knows the numbers is greater, even though the official count is just 130.
I think it would be safe to say
that. But
they're
not saying it publicly because they don't want to create panic and fear.
I don't know what their intention is, but I think that would be reasonable as a reader.
So it's not complacency, as I was suggesting. Yeah. It's actually caution.
It is caution.
Let me at this point put a couple of comparisons to you. One of them you in fact have alluded to yourself. Little Bahrain has tested over 6,100 people per million of population. India's is just about, in fact, under 10. South Korea has tested nearly 250,000 people. India has only tested 11,500. Those are huge differences in those comparisons. Does it worry you?
It does worry me because we've probably generated a lot of secondary infections amongst people who never got tested and therefore have not been quarantined and are practicing.
And they're probably spreading it as well.
They are spreading it right now. They are spreading it right now. And so the virus is out there in the community. And I see, again, this is a question of, Karan, this comes down to, to put it quite bluntly, public communications in the time of a crisis such as this. And this is a kind of crisis which, frankly, this government and governments generally have not been really been tested with, and a lot of them have fumbled. The UK fumbled by saying...
Stick to India. Do you think that the Indian government is fumbling in its communication?
I think they're learning how to do this as they go along. I think the only way in which...
But does that also mean they haven't got it right as yet?
Well, we're all learning, and I think the thing to learn here is that if you don't trust the citizenry with information and be straight with them on the number of cases, you cannot expect them to cooperate with you in the long term for things like social distancing. At some point, people will ask the question, why are you asking me to do something for something?
Absolutely, but come back to something you said a moment ago. By not testing sufficiently, they know there are people in the community with the virus and they're allowing that virus to spread. And so not testing sufficiently actually is leading to them being aware the virus is spreading.
Well,
what do you make of that? Because that's a very odd conclusion to come to.
See, again, I come back to the point that government works under challenges as all of us, and nobody was prepared. They probably don't have the test kits that are ready for this. They probably are trying to figure out their their public communication policy as they're sort of going along. And again, I raise the UK and the US because I'm saying that this is a global phenomenon. The exception is South Korea, which was extraordinary in its response. And the other exception is China, and we are not like China. We cannot shut down entire cities.
Well, in fact, let me give you the explanations given in the last 2-3 days by Professor Ganga Ketkar and Nivedita Gupta of the ICMR, why they are not doing more testing. First, they say they're not doing more testing because they don't want to create and run the risk of false negatives, which creates false confidence and also is a waste of resources. And secondly, they say they're not doing more testing because if they end up with more positives, they may not have the isolation beds for them. What do you make of those two explanations?
So I have only seen the first statement. I've not seen the second statement. The first statement...
The second statement was, I believe, Nivedita Gupta in an interview to the Indian Express yesterday,
I see.
the 17th.
I didn't see that. But the first one I've seen, and I as a scientific expert, I would just disagree with it as a science issue. If you don't actually tell people, so it's not as if there are false, it's not like people are going away without a test and therefore they're thinking I should quarantine myself anyway. You have to give people the positive information on them having coronavirus in order for them to respond appropriately, and this is what years of public communication.
So you're saying run the risk of some people being false negative, right?
Absolutely.
Even if they later on turn out to be positive, because at least you will identify those who are positive and
Absolutely.
not let them infect others.
Absolutely. Why would you not want to know the situation? To say, if I know the situation, then people might respond adversely, therefore I don't want to know what's going on. There is no situation under which we don't want to know what's going on.
Let me then come to two categories of people who under the Indian protocol for testing are presently not being tested and ask you whether that's a mistake. First of all, people who've come directly from abroad, countries which are infected, or have been in contact with someone who's come from a country which is infected, but are themselves asymptomatic, are not being tested, even though they could pass on the virus to others. Is it a mistake not to test this category?
So let me explain a little bit about the testing, Karan. The current testing protocol in India is what is called real-time PCR. You need to have a certain amount of viral RNA inside you in order to be able to run that test. So you're not going to be able to pick it up in everyone unless they actually are they have a strong enough infection. It's a very specific kind of a test. So it's not a test that you want to deploy widely on an asymptomatic population. However, and this is what I've been advising the government to do, which is every case of someone who shows up with flu-like symptoms, has respiratory distress, has a fever, has a persistent cough.
They must be tested.
They must all be tested.
I'll come to that category in a moment's time, but are you saying that the first category, which are people who have either come from a country affected or have been in contact with the person who's had the virus,
Yeah.
but are themselves asymptomatic. There's
Yeah.
no need to test all of them.
We cannot, I don't think there's a need to test them right now because
Let's
we can't actually reliably test
So
them.
this
either.
first category,
Yeah.
it's quite okay for the government to say they're asymptomatic, we
Exactly.
will not test them,
Exactly.
even though they may have come from an affected country, even though they may have had contact with an affected person.
It doesn't matter if they're not, we need to screen them and not test them, and I make that distinction. Screening is you take their temperature and ask about the symptoms, and India does a lot of screening. India doesn't test as
But
much.
testing is not necessary.
Testing is not necessary.
Let's then come to the second category. The second category are people who have fever, who have a cough, who have a cold, but they have not traveled from abroad. There is no travel history, nor have they been, to the best of their knowledge, in contact with someone who's had the infection. Yet they are still not being tested either. Should this second category be tested?
This second category absolutely should be tested, and I think that it will start happening soon. It is the category that is spreading infection in the community. And you have to remember, we also have other flu-like illnesses going on at the same time. So what we want to do is to figure out the proportion of people with cough, cold, not cough, cold, cough, and fever and respiratory distress, the proportion of these are actually because of coronavirus. And this is what I've been urging the government to do in everything that I'm writing.
So everyone who goes to a hospital or with the doctor with a cough, a cold or fever should be tested.
Cough, fever, and respiratory distress
Should be tested. In other words, you're suggesting that there's a fairly sizable number of people who at the moment are not being tested, people who have the symptoms we've talked of, cough, cold, fever, who should be tested. That's the first increase in testing that is necessary.
Absolutely. And I think that number, even if we were to do it just for the large metros and maybe the tier 1 towns, for instance, you're talking about maybe another 10,000 tests a day. And I think it's well within India's capacity to do it. You have to remember, we're not a country without the capacity. We can do this.
And if you've got the capacity and there is a need, then it's not advisable not to use the capacity.
I would 100% agree. And I think yesterday, the ICMR head has actually said that they have now roped in the private labs to do that testing.
I'll come to that in a moment's time. What about asymptomatic people? Are there any categories of asymptomatic people who we should also be testing?
Not with this RT-PCR testing. So the asymptomatic people, we will or should be soon doing what is called a serological test, which is what you look for is people who might have just got a very mild infection and they have seroconverted. In other words, they have developed antibodies against the virus, but nobody actually knows this. So if you test, say, 1,000 people in India and do that serological test, we'll figure out how many of them have actually been exposed
So you're
already.
saying when we are able to do serological tests, then asymptomatic people must be tested. But at the moment, when we're doing a different type of test, which depends upon there being some element of the viral of a fairly size amount in you, it's not advisable to do asymptomatic at this stage.
So Karan, let me actually explain what testing really means. There are two reasons why you sort of use the word test in a broad sense. One reason you test is, I want to find out if you have coronavirus so I can stay away from you. That's an immediate public health need. The second reason I do it is to find out how many people have coronavirus in the community, so that advises, on what I really should do. It's needed for both of these purposes, but the symptomatic ones that we're doing the testing for is primarily for this first purpose, or that's what we should be doing, which is I want to know.
And asymptomatic for the second.
For the second.
And you're saying asymptomatic should only be tested when you can do serological test, not the present test, which is a very different test. Let's then come to what the ICMR revealed yesterday evening at their press conference, that as of Monday, which is 3 days away, they would have 121 government-controlled diagnostic centers, and they're also going to include thereafter fairly quickly 51 or so private laboratories, provided those laboratories A, have the kits, and B, have their protocol up to stream. So given that you're suggesting that we should be ramping up testing to something like 10,000 a day if we take all people who are symptomatic, do we have in place adequate testing facilities now?
I think we do. I think across the entire system, you have to remember, when times are good, most testing actually happens in private sector labs. It doesn't happen necessarily in government. So we do have the capacity to do it, and I think we can ramp up to that 10,000.
So just to sum up this part of the interview, the real problem with the government's attitude to the coronavirus crisis is its reluctance to test more adequately. They in particular need to be testing the roughly 9,000-10,000 who are symptomatic. You're quite happy with the way they've actually controlled entry to the country, and you're reasonably happy with the way in which they're ramping up testing facilities. It's just actually using those facilities that they're not doing enough of.
Absolutely, and I don't question government's motive here. I think they work under these constraints, but I think it's time now to move to more testing, and I think anyone in the infectious disease profession would agree with that.
Let's then come to a different issue. The government is also absolutely convinced, and again, the ICMR at their press conference yesterday evening said this repeatedly, that India is still at the second stage of the epidemic, where the infection goes through direct contact. We haven't got to stage 3, where it becomes a community-based infection. Do you agree with that assessment, or do you have certain doubts and reservations?
So I think we moved to the community infection stage based on modeling and based on the experience of other countries. We think we probably got there about 2 or 3 weeks ago. So it's not something which is...
I'm just repeating what you said, because I think it will strike the audience as a little worrying. You believe, based upon modeling and the experience of other countries, we got to stage 3, community-based infection, 2 or 3 weeks ago.
Let me explain what community, so that we don't scare people. It is that you either are infected because you came from abroad, or the second is you got the infection because of a known contact with someone who came from abroad with the virus. Those are the 2 categories. That are the 2 stages that we think of. The third stage is that you get it from someone else in the community, and you can't trace it back necessarily to someone who came from abroad.
And that stage you think happened in India 2-3 weeks ago?
Because it happened in every country 2-3 weeks ago. It happened in the United States about 4 weeks ago. And like India, the US just did not test.
You're saying, therefore, it's unlikely that the behavior of the virus in India will be different to its behavior in these other countries.
Let me explain that further, Karan. I think I should address this. I think, particularly for your viewership, we are not special as Indians in any way. We might say our namastes, we're hygienic in some ways, we're not in some other ways, but nobody on the planet has any immunity to this virus. So if we think that we somehow are special and therefore we won't get the virus, I think it's time to dispel that notion right away.
Then let me put this to you. You said that the government was not being complacent by not doing more testing, even though they know there's a need for it and they have the facilities for it. What about now on this second point? You're absolutely certain that on the basis of modeling and the basis of the experience of other countries, we've been at stage 3, community-based infection, for the last 2-3 weeks. Yet the government keeps insisting we're not. Yesterday, very forcefully, the ICMR at their press conference said, we're not at stage 3, we're only at stage 2. Now, is that reluctance to accept that we are complacency?
I don't want to question their motives, because again, I don't know why they're saying what they're saying.
Don't question their motives.
I'm just saying
is
that...
it complacent not to recognize a reality that you so clearly recognize?
I'm just saying that the best, we know how to model these epidemics. We've done these for years. And if we look at the experience of other countries, unless India is somehow exceptionally different in ways that we don't understand, this is probably
And we have
true.
no reason to believe in either.
We have no reason to believe that we're exceptionally different.
So all the logic suggests we are not just in stage 3, but we've been there for the last 2-3 weeks.
We probably have been there for the last 2
So then what do you make of the fact that the government keeps insisting we're not?
Again, you're getting to a motive question, which I can't answer for the
No,
government.
I'm not asking what their motive is.
Yeah.
I'm just saying, what is the consequence of the government insisting we're not in stage 3 when all the logic, all the experience suggests and all the modeling suggests we are?
Why don't you look at the government's actions? The government action has been to really shut down the place, whether it's planes, whether it's to do with planes coming from abroad, etc., etc. I think that...
And that suggests that we are in stage 3.
I think all of that suggests that we're in
So
stage
their
3.
action once again suggests we're in stage 3, even if their verbal admission falls way short of it.
I think so.
In which case, let me put this to you. What are the critical steps that need to be taken now? The logic of the situation, the logic of modeling, the experience of other countries suggests we've been in stage 3 for the last 2-3 weeks. What critical steps are needed now?
I think that's a great question. So if we look at what happened in... So let me just back up here. What are we most concerned about? We're concerned about people with severe cases who have to be hospitalized, who might need a ventilator, who might need, respiratory support. And we are a country without a huge number of hospital beds in general. We have about 70 to 100,000 ICU beds. We probably have fewer ventilators than that. And we're not like China that makes a lot of this equipment. At the peak of the epidemic, according to projections by the best modeling groups in the UK and the US, their estimate is that they would probably have about 500,000 severe cases probably 500,000 to a million severe cases in the UK, and upwards about 3 to 4 million severe cases in the US.
How many severe cases could we end up with?
So you can do the math, and I would guess that we will end up with something, about 4 to 8 million severe cases, and we only have about 70,000 hospital beds. So I think the time to start...
Which means we're something like 7 million beds short.
We're about 7 million beds short.
What about ventilators? What about doctors? What about medicine?
We don't have any of these, and you have to remember, at a time of crisis like this, our doctors are on the first line of defense, and therefore the rate of coronavirus cases and deaths amongst the medical fraternity in Wuhan was 2%, grossly disproportionate to their population.
And it's already begun in Canada, where some doctors have had to quarantine themselves because of some lapses or some communication with an affected patient.
This is a highly infectious
so
virus.
You're saying to me we're unprepared for severe cases that you believe could go up to perhaps 8 million in terms of beds, in terms of doctors, in terms of ventilators, in terms of medicine. In all those levels, we are unprepared.
We don't necessarily have treatment per se for this at this point.
So is the first thing the government should do is to place orders to import all of this immediately?
I think that's what I would do. If I were in their place, I've called for this actually for the last 2 weeks now, which is to say, let us not wait for that tsunami to hit us and then start planning. Let us now already start thinking of temporary facilities like stadia, like the Chinese.
Do you have any sense of what response the government has given to these calls from you?
They have said that they have booked bed capacity in private hospitals. Some states like Tamil Nadu, for instance, which have reached out to me, they have done something smart in terms of making sure that all elective surgeries are now postponed for a 2-month period. So you can't get a...
But is that anywhere near sufficient? Booking space in private hospitals or postponing elective surgery?
I don't think it is.
So the responses are a few, but you're saying they're hugely insufficient.
Well, Karan, let me also back up here and say that, keep in mind, people like myself, we sit and think about these kinds of events for years before. We've been thinking about these for like 20 years.
That's when the government needs people like you. And they should, when they have people like you, follow your advice. But what you're suggesting to me is you've given advice, they've done a little, but what they've done is hugely insufficient.
I don't think it's beyond, I think it's beyond the imagination to understand what is up against us. And I think...
You mean it's beyond the imagination of the authorities who we've elected to control the virus for us to imagine what they're up against? They can't understand what they're up against.
I don't think anyone in our society understands what we're up against, because we've not faced something like this since the 1918 flu pandemic. And I'll tell you something about that.
No, let's not go to the 1980 flu pandemic because we're running out of time. Stick to this because I think this is so important.
Okay.
What about other measures? Cities and states have shut down cinema halls, they've shut down theatres, they've shut down schools and colleges. Are there large towns and metropolises that perhaps should be locked down so that spread is prevented? We already know that we've been at stage 3 for 3 weeks perhaps.
Yeah.
Should we control spread?
I think that stage will definitely come. See, you have to bring the public along. If you were to just shut down everything right now, you're putting people at risk in terms of... Remember, we may have a salary. There are people who have to work for daily wages in order to put food on the table. China was able to do that kind of a shutdown because they delivered food to every person in Wuhan, every one of the 16 million households in Wuhan, or 16 million people.
I don't mean that we should actually shut down people within cities, but should we shut down access to those cities? In other words, seal off the Delhi, Bombay, Calcuttas, Chennais, so that they remain self-contained, hopefully.
Not very useful, because the spread between cities is not the issue. The spread within the cities is the issue. So the Wuhan quarantine was not about cutting off Wuhan from the rest of China, although that was partly it. It was also about cutting off people in Wuhan from each other.
And we don't have the capacity.
We have no capacity.
To A, cut them off, and B, supply them with food and other facilities.
We just don't have the capacity to do
Let
that.
me then put this to you. Do you believe that India could become the next hotspot? That is something that Bloomberg has written about. It's in the Indian papers today. Do you think India could become the next hotspot?
Let me just say that every sensible projection at this point indicates that this is likely to happen for a variety of reasons.
Likely to become the next hotspot?
Likely to be the next hotspot because we have the ability to transmit the virus very easily. Contrary to what many people think or believe or hope, there is no evidence that the virus slows down in the heat. We just don't know that, and we can't rely on that. And the third is, typically the impact of a virus is a function of three things. It's a function of how fast it moves. This one moves quite fast. How much it kills. It kills about 20 times more than regular influenza. And then the third is your health system capacity. So
And that's woeful.
That is woeful. I think we can all admit that.
Is there a fourth? The density of the Indian population. According to Bloomberg, it is 420 people per square kilometer in India. In China, it was 148. In other words, China is one-third our density. If China could get such a massive spread so quickly, which they were able to contain, will it not be worse than India? Particularly because here, social distancing is difficult because a lot of people, particularly in cities who are poor, live in one-room flats. How do you social distance then?
Exactly. Social distancing is truly a luxury that's reserved for some of us. About the density numbers, you have to remember that most of China is a desert. So actually the density in the parts of China where people mostly live, whether it's Guangdong or Wuhan,
It's probably higher
is
than
probably higher than what we have. So, or the same or higher. So I don't think
the Bloomberg statistics are misleading.
they're misleading because it's an average across
What
the
about the
country.
problem of social distancing? In India, it's very difficult if you live in one-room houses.
It is not only difficult, we're trying to communicate to a population which just does not understand why this is the case. If people don't know the germ theory of disease, or we're dealing with a population that, see, in China, you can be authoritarian and you can force people to do stuff that they don't believe in. We Indians are not amenable to stuff that we don't actually believe in. If we don't actually believe it, we just won't do it. And that's just our nature, and that's
these
how it
are
works.
all the different reasons. The fact that social distancing is going to be very difficult
Very
to
hard.
achieve, the fact that the virus spreads rapidly, the
Yes.
fact that its death rate is something like 20 times the normal flu,
Yeah.
right? All of that suggests to you that India could become, I'm saying could become the next hotspot.
I think it very certainly could be the next hotspot.
In fact, Dr. Devi Shetty of Narayan Health, writing in Times of India the other day, said we could end up with 10% of the population infected. And if that happens, that's over 100 million people.
I think it would probably, again, I don't want to be alarmist here, but I want to, give you the straight dope here. We probably will end up with, the US projection is about 20 to 60% of the population infected. We're no different again there. So it's not 10%.
20 to 60?
20 to 60%. Remember, this is a virus against which we have zero immunity to.
I'm alarmed because you're suggesting a possibility of something like 700 or 800 million people being infected.
Well, remember, the infection is not the main issue. And again, the infection is not the main issue because most people will self-resolve. Again, for your audience, when you hear stories of such and such person had coronavirus, but then now they're okay, that is the norm. 98% of people with coronavirus will be okay. So having a coronavirus infection itself is not a death sentence. It is that 2% is disproportionately people above the age of 65 who also have uncontrolled comorbidities.
That's happening in Italy, where 70 to 80% of those who have died are over the age of 80.
Absolutely.
So you're saying, and this is so important, I'm clarifying it because otherwise it could be very alarming for the audience, that in America, where modeling suggests you could end up with 40 to 60%,
20 to 60%.
20 to
It's a big range,
60% of the population infected. That suggests that the same is likely to be the case in India. There's no reason why the percentages should be different. And if the percentages are like that, then at the upper range, and I emphasize it's the upper range, we're talking of something like 700 million people being infected. And you added, and this is also very important, that these are people who may only have a mild infection, right? But they will still technically be infected. The percentage who actually end up being seriously ill is much smaller.
Much smaller.
And the percentage that end up sadly dying is even smaller than that.
Right.
But of that percentage who die, a disproportionate number would be over the age of 60.
Yes.
Have I repeated that correctly? Because I think it's so important that people need to be sure I've got it right so that audiences don't get alarmed by these statistics, which otherwise, I'll be honest with you, it's very alarming to hear that up to 60% of India could end up infected.
Well, that is the high end of the range, obviously. So, we should hope for the 20%. And again, Karan, we've got to remember that for typical influenza, where we end up with about 500 million cases a year, we do that every year, we get about 500 million cases. We're not practicing social distancing. So the fact that all these measures have been undertaken are not for nothing. So this is actually going to help us in some way in terms of reducing that number, and as has now been popular, flattening that curve.
All of that will help, and maybe this will help as well. Keep your fingers crossed.
Keep your fingers crossed.
Let's take a break at that point. When I come back, I want to ask you a question which I think after part one will be uppermost in the minds of the audience. What can we, ordinary people, many of whom are probably very worried, and perhaps even more worried after part one of this interview, what can we do to protect ourselves and stay safe? That's in part two. But first, a message from our sponsor, Glenlivet, while I'll take a reassuring and, might I add, a badly needed sip from this glass.
Take a little trip with me, I'm gonna take you home.
Take a little history
Take a little
down this lane of memories.
down this lane.
So let's raise another glass for the glorious past and the friends we have become. Yeah, yeah, 'cause little did we know the good times come and go, but the best is yet to come.
Welcome back to a special interview for The Wire. Our subject today is coronavirus. And now we're going to turn to that subject that is perhaps uppermost in everyone's mind. What can we ordinary people do to protect ourselves and stay safe? And my guest is someone who clearly has the answer. He's the director of the Center for Disease Dynamics and a lecturer at America's Princeton University, Ramanand Laxminarayan. Dr. Laxminarayan, I was going to start by asking you, what's the worst case and what's the best case scenario 6 months down the road? But I have that answer. We ended part one with your saying that at the upper end, the worst case would be something like 700 million people infected. So I won't ask that question. Instead, let me begin with a slightly different question. This is perhaps the first pandemic in the age of WhatsApp, Facebook, Twitter, Instagram. Has that given us the potential to be better informed, or has it perversely simply fueled fear and panic?
You know, that's a great question, and actually something that we actually think about when there are not pandemics around. It's helped in both ways. The 1918 flu pandemic, which is our closest, and you have to remember, during 1918, somewhere between 30 and 70 million people died. And of that number, probably a third were Indians who had come back from the First World War and brought the virus back here. If you think about it, there's no real living memory of that entire event here. But that virus spread so much also because people just did not have the information that it was spreading. In one example,
Now social media ensures we do.
ensures that we do.
So therefore, social media is a form of protection here.
It's a form of protection. I'll give you one example. There was a village in Alaska where a mailman carried the virus and wiped out the entire village in this Inuit village in Alaska. That won't happen now because that Alaskan village will just stop the mailman because there'll be social distancing.
What about the other aspect of social media? Is it fueling panic? Is it fueling fear?
It is fueling fear because there's a lot of misinformation out there, and I think, I'm sure you'll ask me about what to do, and I think that a lot of what we should be doing here is fairly commonsensical, and it's not something that is outside of our realm of possibility to protect ourselves.
Let me then upfront ask you that question. What should ordinary people who have a certain amount of fear in their hearts do to protect themselves and stay safe?
So, great question, and I'll repeat what WHO, the government of India, everyone says, which is the very first step is if you have a cough or a fever or respiratory distress, difficulty breathing, those are potential signs of coronavirus, although not necessarily the case. If you have any of these, please stay indoors and do not go out anywhere. Don't expose anyone else. And if you have that, cover your mouth when you cough. In the United States, all kids learn the scarecrow cough. Good for your listeners to hear, or viewers to hear. You basically cough into your elbow. These are basic things that we don't see in India. You see people coughing
into your elbow,
your
not
elbow.
just like this as
No,
you do.
because if you do this into your hand, you might touch your face or you might shake hands with someone and you do it.
So this is very important.
Always
I'm
cough
repeating
into your elbow.
It's important to cough into your elbow.
Please.
And if you have a cough, if you have some form of respiratory distress, if you have a cold, if you have fever, stay indoors.
Stay indoors. And yeah.
We're constantly told that you need to wash your hands. How often do you need to wash your hands? I mean, people normally do it when they're dirty. Nowadays, perhaps people are doing it 5-6 times more per day. But how often is it necessary to wash your hands?
So my advice to my team is that you wash your hands 4 times a day when you come into work. You wash when you come in. You wash twice again during the day, and you wash before you leave. And you please, if you can, take a shower as soon as you get back home. So these are your personal hygiene measures, which I think.
But 4 or 5 times a day is sufficient hand washing.
Absolutely.
You don't have to become obsessive about
No,
it.
you don't have to be obsessive about
What
it.
about masks? Is it important to wear a mask all the time when you're outdoors?
Please do not wear a mask. In fact, that would be my strong request. I don't think I can say this enough. There are people in hospitals around the world who have a shortage of masks because masks are only for healthcare professionals or for people with coronavirus cases or symptoms. If you don't have either of these, please do not use a mask.
So there's no need to go around wearing a mask just because you're walking outside the front door. And secondly, you're saying if you wear them when they're not needed, you're denying it to healthcare professionals who do need it.
Absolutely.
Let's come to that point you made, that if you have a cold, you have fever, you have respiratory distress, right, stay indoors. What does self-isolation actually amount to?
Self-isolation is basically the idea of, so let's break this down again. What's the virus really doing? The virus is just trying to move from the infected person to someone who's uninfected because otherwise it doesn't survive. That's all it's trying to do. It's just a creature just like us. And it does that purely through droplets. And so it's the cough droplets that are moving from one person to the other that really cause that transmission. Now, people are worried about, some guidance says don't touch infected surfaces. We don't actually know which surface is infected. I don't know if that surface is infected. It's not like bleeping red at me because it's infected. I would say please just exercise common sense here. That's all it is. The common sense is that if someone is in a room and they have symptoms of what you think might be coronavirus, of course, hopefully soon they will be able to be tested, but if they've not been tested, you basically just make sure that they keep a safe distance, maybe a meter or two from anyone else, so that any cough droplets don't reach the other person.
Well, the critical question is this: if someone in your family is under self or home isolation, what sort of access to them can you have? Can you go to their room to serve them food, for it?
Absolutely. You have to again remember the coronavirus is not a super infectious disease. And let me give it to you in numbers. Every case of coronavirus will generate somewhere between 2 and 3 secondary cases. For measles, every case of measles will generate about 15 to 20 secondary cases. So coronavirus is not a hyper-infectious disease. It's not like Ebola. It is actually reasonably, containable. And I think,
So if someone in my home is self-isolating, I can walk in with a tray of food.
yes,
Would it be essential to leave it 2 feet away from them, or can I actually give it to them?
you can actually give it to them. I would not.
What about when they've finished eating? Is it safe for me to wash the dishes they've eaten in?
I think it's safe to wash the dishes that they
What
eat
about
in.
their clothes? Can I wash their clothes? Can I take them and put them in the washing machine or something
You
like
can, as long as you're doing the other stuff, which is you're washing your hands regularly and you're not touching your face with your hands and you're keeping that distance from them, you're fine.
that? And is there need for me to wear gloves when I pick up their plates or their clothes?
No, there's no need for that as long as, again, you're washing your hands after you've picked up their plate.
Come back to another question, because I think it's critical. You began by saying people who have a cough, cold, respiratory illness, or some fever should stay at home. But for how long? Till it goes off? Do you need medical advice? What do you need to do beyond staying at home?
So the standard recommendation right now is a 2-week quarantine period. If you are not sure and you have no symptoms at all, then it's a 1-week quarantine period during which your symptoms will show up. The thing about the coronavirus is it has this long stage of latency between when you're infected and when you show up at symptoms. It's about 2 weeks. So 2 weeks.
So if you have a normal cough, cold, and fever, stay home for 2 weeks.
So 2 weeks.
At what point do you begin to say to yourself, this may be more than just cough, cold, and fever? What are the signs that make you slightly alarmed and want to seek a test?
Again, the respiratory distress, difficulty breathing is an important
That's
part.
the most important
That's
sign.
an important one because that's what really distinguishes this from the others. If you have again, I repeat these 3. A cough, a persistent dry cough, not a phlegmy cough necessarily, a dry cough, a low-grade fever, and or difficulty breathing,
Is it
then see your
any
doctor.
one of the 3 or all 3 together?
Well, in some people it's only 2 out of the 3, some it's all 3 out of the 3. But generally, if you have 2 out of the 3, I would go in to see a doctor or inform a doctor or get someone to get you a test.
So just to repeat, if you have an ordinary cough, fever, cold, stay at home.
A dry, persistent cough.
Stay at home
Yes.
for a week or 2.
Yes.
But if it persists and you have low-grade persisting fever, dry cough, and respiratory thing, and it carries on for 3-4 days, start getting yourself tested.
Absolutely.
So for the first 3-4 days, you can say to yourself, this may be just a normal flu. But if it carries on beyond 3-4 days,
Yes.
then you need to get tested.
You need to get tested, and I think the recommendations will change that any medical practitioner will be able to recommend a test for you.
So the threshold is actually, for the first 3-4 days, sit at home. It may be just a cold, it may be just a cough. But if it persists beyond 3-4 days, get yourself tested.
Exactly.
Now, all of us know this, all of us have laughed about it, but I'm going to deliberately ask you. The Hindu Mahasabha has sent out WhatsApp messages to say that Gaumutra and Gobar baths can protect you from getting coronavirus. Could there be any truth to that?
There is no scientific evidence to back that up. So,
At all?
At all.
There are also a whole flood of homeopathic and Ayurvedic advice coming up on WhatsApp. Do you give any credence to it as a doctor?
No, homeopathy is one of the forms of alternative medicine which actually has virtually no scientific evidence behind it. And Ayurveda does, but in this particular case, I don't know enough about what is being proposed, so I couldn't really comment on that, but I've not seen anything.
And there are also a lot of people who are saying, drink a lot of water, hot water in particular, take a lot of lemon. Does any of that help, or is that just grandmotherly, good-natured advice, but not really helpful?
Well, it's all symptomatic relief, and to the extent that if you think about it, if that prevents you from coughing and spreading the virus, then it's worthwhile. So do whatever makes you feel good, but the virus is going to run its course, and keep in mind that most of the time it's just going to be a mild-grade infection. It's going to be just like a low-grade flu, and then it's gone.
In fact, the truth is there is no real treatment for this virus, is there?
Well, there is no current treatment. There is some evidence from some countries that some antiretroviral drugs may be helpful.
Including our Jaipur. There were a couple of Italians who were treated in Jaipur with antiretroviral drugs and apparently recovered.
Well, again, it's unless they were done on a clinical protocol which tested people with and without, they might have just recovered like all of these cases will do. So the fact that 3 people got the drug and recovered would be
doesn't mean it's because of the drug.
Doesn't mean it's because of the drug. It might be because of the whiskey that they had.
So are you therefore saying that there is no known scientific treatment or cure at the moment?
That's correct.
What about a vaccine to prevent people getting it? Moderna Therapeutics in Seattle is apparently human testing a vaccine they've developed, which is based upon a genetic copy of the genetic code of this virus. As an expert in the field, what are the chances this could succeed?
So vaccines, because of safety reasons, we don't want to hand out a vaccine that has side effects of its own that ends up causing more damage than than what you're preventing. Because remember, the virus may only kill a few people, but the vaccine, if you give it out to 60% of the population and has side effects which are significant, you've inadvertently caused a lot of damage by doing that. So we always want to be careful about vaccines. I am aware of the Moderna vaccine. We're all hopeful that or one of the other vaccines will pan out. And truth be told, Karan, this is not a virus that's going to stay with us for years. We will have a vaccine, I think, within 18 months. Almost.
But it may be as long as 18 months.
Well, I think the guidance right now from US NIH is between 12 and 18 months, and I think that's what I would stick to.
So you're also saying that whilst we all hope that the Moderna vaccine will actually turn out to be successful, we won't know for sure until the tests are thoroughly done, and therefore don't believe that there's going to be a vaccine in the next 4 or 5 months.
No, and especially not for the next 2 to 3 months, which is where we are going to experience the biggest challenge with the wave of cases.
So for the next 2 or 3 months,
yes,
when this is going to build up, possibly exponentially, good sense is our best cure.
Good sense is our best cure, and taking care of people around us is also essential.
Finally, you know the Indian healthcare system. What would be your advice, particularly in the light of the challenge we face today, to the government about devising healthcare policy for the future and healthcare budgets? What advice would you give this government?
I think after an event like this, you don't even need to give the advice, which is that if we had a strong public health system, if we had the medical professionals that we need, if we had the nurses that we need, we would be in so much better condition to take on a crisis like this. Because the health sector has not been well funded for many years now, we face a weakened health system, and we're using that to confront what is essentially an epidemic of outstanding proportions. And that's
So
really,
you're also saying, aren't you, that at the very top of the government's priorities must be fund your healthcare adequately, so that you actually have a system that can take care of people, particularly at emergency times like this?
I think I could say it 1,000 times and it would not be enough.
At this present funding, which according to Bloomberg is just 3.7% of GDP, is far, far too low.
We're not at 3.7% of GDP.
So again, Bloomberg is wrong with this.
Bloomberg is wrong. We're probably about 1.4 or 1.5% of GDP.
Which is woefully inadequate.
Which is woefully inadequate, and many of us have been saying this for a long time. So this is, it's completely inadequate to the size of our country and what the challenge is.
Roughly, and I'll end with this, where would you like to see funding go to? It's at 1.4, 1.6%. Would you say it needs to go sharply to 3.5?
So I think this again is something which we've talked about a lot. It should go to about 2.5 to 3%, which would then bring us in line with other countries with our similar level of income and what our own needs are.
Let's hope the government is listening. You've given us a very honest, candid interview. I have to be also truthful and say that there's a lot that you said which will worry people, particularly the possibility, and let's hope it's only a possibility, that at the worst case we could end up with something like 700 million people infected. But thank you for opening our eyes to a reality that we can only benefit from knowing fully.
To receive instant updates on all videos from The Wire, click the subscribe button and hit the bell icon. Pay to support independent journalism. Click the link in the description and choose the amount you want to pay.